Good morning. On behalf of the Florida Sheriff's Association, I'm Don Eslinger, Sheriff of Seminole County, Florida. I would like to thank you for coming to address this critical issue facing our state. I would like to welcome and also thank our press conference participants, as well as the media for taking their time today. The Don't Let Florida Go to Pot Coalition was formed out of the overwhelming concern we have for Florida youth, which is why it's very important that we continue to educate the people of Florida of the ill effects of legalized marijuana. All we have to do really is to look at other states and see where they have legalized marijuana and the challenges they face on a daily basis, whether it's the increase of driving under the influence or business owners struggling to address the issues of their employees coming to work under the influence. The examples of negative consequences of marijuana are everywhere, and that is why we supported Charlotte's Web, medical marijuana that is not smoked, low in THC content, and helps patients while not getting them intoxicated. You know, the media has highlighted several issues that will face Florida law enforcement if this is passed. Those issues are significant, such as the creation of an additional black market of diverted medical marijuana. And remember, it is against federal law to transport drugs across state line. How the border states will handle these issues in coordination with Florida law enforcement is significant and will impact us all. I'm proud to say joining us today is Rachel O'Brien. Rachel is a lawyer and an expert on marijuana law and policy. She's from the state of Colorado, serves on a task force there, and she is willing to talk to us about the problems that Colorado has and continue to face. Rachel?
Good morning. Thank you all for being here today. I became involved with the coalition because I think it's very important for Florida voters to ask themselves how far they're willing to go with marijuana legalization in the state. Imagine a Florida where it's more convenient to buy marijuana than it is to buy a Starbucks Grande Latte, a Big Mac. That's the situation we have in Denver right now. We have more marijuana, medical marijuana centers than we have either Starbucks or McDonald's in our city. That's before we recently legalized recreational marijuana, where we added many more shops. The situation didn't begin in 2012 when we legalized recreational marijuana. It began 12 years before that, in 2000, when my state passed a medical marijuana amendment to the Constitution that was intended for compassionate care. Instead, what we had was an amendment that was so broad it allowed for easy access to marijuana by many individuals who used it recreationally. Florida voters are faced with the same choice of legalizing marijuana right now, and they should ask themselves whether they want recreational marijuana legalized as well, because I believe that's the direction that the state is going. And I've compared the two constitutional amendments, and I find several fatal flaws in the Florida Amendment 2 that mimic what Colorado did 14 years ago. First off, Florida's Amendment 2 will allow for any medical condition to qualify for marijuana treatment. It defines a debilitating medical condition to include other conditions for which a physician believes that the medical use of marijuana will outweigh the risks of marijuana use to the patient. This amendment will swallow, this exception will swallow the rules. The end result will be patients will use marijuana recreationally, despite the stated intention of your amendment. In Colorado, we had the same thing happen 14 years ago. We permitted the medical use of marijuana for severe pain. Consequently, our patient registry has approximately 94% of the patients who list severe pain as their primary diagnosis. Now, severe pain is a subjective, unverifiable condition. Patients with cancer amount to about 3% of the registry. Patients with seizures, 2%. Patients with HIV or AIDS, 1%. A second fatal flaw, I believe, is the permission to develop food products. That's in your Amendment 2. Now, even though most types of medicine are not embedded into food, these products will make it easier to discreetly consume marijuana. I always say that if it looks like a duck and quacks like a duck, it's a duck. But I don't think that food looks or acts like a medicine, all right? In my state, we have marijuana now in salad dressings, in candy. Brownies are very yesterday, okay? In my state, it's in just about any food you can imagine. We even have companies that purchase marijuana candy off the shelves and spray it with marijuana. And that reason is not to be medicine, but to expand use and make it very easy to try marijuana. The scientific literature is pretty clear that edibles are the very worst way to dose, okay? There are problems with absorption and delayed onset of pain relief. And then third, another fatal flaw is that there are no age limits in your medical marijuana amendment, all right? In addition, when you add patient confidentiality, what you will find is that this will open the door for Florida teenagers to get their hands on marijuana without parental notification, parental consent. We had the same thing happen in Colorado. Our Amendment 20 placed no age limits on it. It does actually require parental notice and consent for people under 18, but between 18 and 20, we do not have those rules. Makes it very similar to what's going on in Florida. The end result is that since December of 2012, we've had a 46% increase in the number of patients between 18 and 20 with a legitimate or with a legal marijuana card. And those patients are the ones that are sharing it in our high schools. So this has significant social and educational implications for Florida youth, because there are long-term studies out there that show that weekly use that begins under 18 has resulted in permanent IQ decline. There are other flaws that I could go into detail on, but in the meantime, I just want you to take a look here. A ballot summary in Florida is limited to 75 words. And on the right is the ballot summary as it reads today. And on the left is the ballot summary that I propose voters need to understand. What will this amendment do? It will allow the use of marijuana for any medical condition. It will allow teenagers to obtain it. It will allow for the development of marijuana foods, including candies that will appeal to kids. And it also will allow, it won't recognize private property rights of landlords, and it also waives civil liability and criminal liability in almost every situation. So it just is very important that Florida voters really understand what this amendment will do. Now I am going to pass the podium on to Calvina Fay. She is the Executive Director of Drug Free America Foundation. Thanks.
Thank you, Rachel. Good morning. Thank you for allowing me to speak to you. I am Calvina Fay, the Executive Director of both Drug Free America Foundation and Save Our Society from Drugs, and we are very proud partners of the Don't Let Florida Go to Pot campaign. You know, our organizations are national in scope. We happen to be based in St. Petersburg, Florida, but we've dealt with this issue all over the country, and we've seen the stories that you've heard from Rachel in Colorado, but we've seen it in all these other states too. We deal with it on a daily basis. Let's not kid ourselves. This amendment that we're facing is, in fact, de facto legalization. It's not just the legalization of the use of marijuana, not just about somebody smoking pot in their bedroom. It's a big marijuana industry that will be legalized if it passes. It involves the cultivation, production of it, the trafficking, the sale, the use, and most importantly, the promotion of marijuana. And make no mistake, it will be promoted to our kids. It's a powerful product today. It's not the stuff smoked in the 60s, especially with the dabbing process going on now. We have reports of people using marijuana with a THC level of 80 and 90% THC. So that's pretty powerful stuff, and people are ending up in the hospitals. The data from the states across the country that have done this already speak very clearly, very crystal clear of the impact. The proponents of this measure would have you believe that it's restricted to serious medical conditions. As Rachel has pointed out, it's not, and I can assure you it's not about medicine. The average Coloradan with a medical card to purchase marijuana is a 42-year-old male, and as she said, 94% are treating pain. In California, where they've also done this, the average marijuana user there, under the guise of medicine, is a 32-year-old male. It's hard to believe that people so young can only find relief from this one product. It's also interesting that those age groups and the fact that they're predominantly male fits with the category that we see typically of the typical drug user. Not to say that it's exclusively male or exclusively young, but that's what the majority fit into that category. And in fact, the Tampa Bay Times, Miami Herald PolitiFact investigative team actually looked at this issue, and I'll give you a quote that they said, it would be there is available evidence does suggest fairly strongly that the people who use marijuana for cancer or AIDS is a small percentage of all users. So they agree that this is what's happening. And this is precisely what we saw when Florida was overrun with pill mills. I believe that it will be the same scenario, the same type of doctors. The doctors that were handing out highly addictive, high-powered oxycodone and OxyContin to patients who drove here from hundreds of miles away, creating what was known then as the OxyContin Express, I believe will exist. Now they'll be peddling marijuana in addition to their pain pills or instead of their pain pills. Do we really think that there won't be doctors who will do this? It's been done with the pain pills. We're certain it will happen with the marijuana. The proponent's own attorney, actually, when he was testifying before the Supreme Court on this amendment, when they were trying to put it on the ballot, admitted under testimony that that there would be doctors presenting recommendations for marijuana to students, because if a student said that he was stressed over exams, that it would be up to the doctor's judgment whether to give him marijuana. Actually, the Vote No on 2 campaign has captured that testimony on video and has made that available. So for any of you that don't have that and want it, I'm sure that you could request it. In a recent survey, Healthy Kids Colorado reported that 51% of high school seniors in Colorado know someone with a medical marijuana card and have gotten marijuana in the last 30 days from somebody who has one of these cards. And we're seeing the diversion in other states in addition to Colorado. To think things will be any different here is terribly naive. I agree with Rachel that approval of marijuana for supposed medical purposes will lead to eventual recreational legalization. Approval of Amendment 2 is, in fact, de facto legalization. The data and the history in these other states show us that. I thank you for your attention and for your time of being here today, and I'd like now to open up for questions for any of us that we could answer for you. Thank you. Questions?
Isn't the responsibility for the regulation really up to the Department of Health? We've seen them go through rulemaking with the Charlotte's Web, and aren't they the ones that determine how a physician would do it, and shouldn't we trust the Department of Health? Because we trust them with Charlotte's Web.
Amendment 2 adds Section 29, Article 10 in the Florida Constitution, and rulemaking authority is to the Department of Health, but it cannot be more restrictive than what is on the ballot. The Florida or the Tallahassee Press Corps knows that this, Mike, amends our Constitution, and the rulemaking authority to whatever department cannot be more restrictive than what is on the ballot. And as both pointed out, you know, the summary is misleading. real doctors are against this. If they wanted an age requirement within, or some type of parental consent, it would have been written into the amendment. We cannot vote on something that is incomplete and hopefully will be fixed by someone else. Unlike a bill that becomes law, if we discover some unintended consequences, we could fix it next session. This amends our Constitution and would be absolutely impossible to undo.
How is it different that the physicians can order marijuana for minors than what they can order for a regular prescription drug for a minor without a parent's consent?
This does not allow for, it's against federal law to prescribe marijuana. Only a physician in Florida on this amendment can recommend the use. DOH would then issue a card, and that card then would be produced to the dispensary, and that marijuana would then be provided.
And I would say the amendment,
In front of the microphone,
Sure.
please.
the amendment itself has a provision that mandates the Department of Health to protect the confidentiality of patients. So how will they go about doing that? Will they create rules that not only make the registry confidential, but require that doctors maintain the confidentiality of their patients? And I'm not sure that patient confidentiality is written into other general medical statutes. So,
Rachel, can I ask you to, this is subjective undoubtedly, but in your state, medical marijuana was approved 2002?
2000.
2000. So you had a 12-year gap then before it became recreational. Does that suggest that there became, that program was being run effectively and that the public became more tolerant?
It actually indicates that it wasn't being managed effectively. And what we had, exactly what Calvina said, we had de facto legalization in our state. We had 3 audits come out just over a year ago in April of 2013 and July of 2013, auditing both our health department and our Department of Revenue, which monitors the dispensaries, okay? They found so many blatant, egregious problems. We had doctors, 12 doctors prescribed 50% of the, recommended 50% of the patients, accounted for 50% of the recommendations. We had, going back actually in connection to answering your question, medical necessity is written into our Amendment 20, which said patients will have the right to 6 plants unless medical necessity requires more. Well, in 14 years, our Colorado Medical Board and our Department of Public Health and Environment has never defined medical necessity. So we have situations where patients have been recommended over 500 plants. One patient. Now, if anybody knows 500 plants, that's probably enough to supply an entire town with marijuana, okay? This was given to one patient. I worked on a committee to look at interim production limits as we transferred from medical to recreational. It was really hard to get a handle of what the market actually was in medical because of all these extended plant counts. You had patients being recommended astronomical amounts of marijuana that couldn't possibly have been consumed by one person.
So the voting public in Colorado gave up and just opened the door?
They brought honesty back to our Constitution because we had so much. I can't tell you how many young 20-something men show up for their medicine on a Friday afternoon. Okay, our dispensary's closed at 7. They're walking in completely able-bodied, very young. Again, the profile is of a young recreational user. Not only is the general population of patients 2/3 men, our general population is roughly 50-50. It's 101 men to 100 women. But our medical patients, it's 66 to 33.
So
I could follow.
Since it passed, what negative impacts have you seen on Colorado? Do you have any data or any information that shows the negative impact that it has had since it passed?
Now, meaning our recreational or our medical?
Your recreational. and medical, but have you seen an impact overall?
Well, on Monday, the Denver Post just came out and identified the fact that crime has skyrocketed in downtown Denver. All right? We've added 10 police officers, but that's still not enough to handle the scenario. Our business community in downtown Denver has had to foot the bill for more police protection because of crime.
But is that related to marijuana use?
It's gone up just in this year. They said that the crime downtown has skyrocketed since the beginning of this year.
Have you done any study about these marijuana users who get the orders from their doctor? You're saying they're overwhelmingly men. Is there any other similarity among that group? Like, are they football players? Former football players?
In my state, they're probably snowboarders or skiers, right? They are, no, other than that they all are claiming pain as their diagnosis.
Like
They're
football players,
men in pain,
former athletes.
so.
But now, that spike occurred after the legalization of recreational marijuana, did it not?
Which spike?
The spike in crime, the spike in DUIs, for example, statewide in Colorado, the spike in fatal slip and falls in Denver that we've heard about over the past 6 months or so. So can you draw a correlation between the legalization of recreational use of marijuana and that spike? And if there is a correlation, might that indicate that medical marijuana might not be as intrusive?
Well, here's the deal. With recreational, the number of users has gone up significantly, right? We've got it in many, many more households. So we still had 115,000 medical patients. That's what we had at the start of let's see, this year. But now we have, I think, 400 and some thousand people who have purchased marijuana since the start of the year. Correlation, association, you know, that if the crime's gone up since January and this has happened, have they tied it?
You might want to, and it's available online, but I'm happy to get it for you. The HIDA out there, the High Intensity Drug Trafficking Area, did a study, and they did it prior to the legalization, back when it was just under medicine. And they have measured and reported out significant increases in impaired driving, significant increases in the diversion of marijuana, crime impact, a number of things. So I would highly encourage you to look at that report, because that does separate the so-called medical marijuana versus the recreational marijuana.
And one issue, I was just going to say one other thing. I think we probably are seeing an underreporting of drug-impaired driving. Reason being is it's not easy to test for THC impairment or blood THC. When a police officer arrests a driver for being impaired, it's really easy to do a breathalyzer test, right? And if you can get them on one count, to have a police officer escort a patient for a blood draw is very time consuming and resource intensive. So when they get them on alcohol, they don't even go so far as to check drugs. And in fact, until we legalized recreational marijuana, it wasn't until 6 months later that we had a blood THC level even on our books. So the numbers, I think, will be telling, and they will continue to go up as we develop tests that can be done in the field for THC.
Right. You refer to that as a fatal slip and fall of the 18-year-old going off the 4-story balcony, so delusional after eating infused THC products. I spoke to the district attorney in Denver. He refers to Denver to the Amsterdam of America. Well, Rachel corrected me, because Amsterdam has lowered their THC levels to 15%, and there's over 30% are being sold and distributed of THC products in the city.
That slip and fall, I didn't even understand what you were referencing. I apologize. That was Mr. Thamba. He was a 19-year-old college student who came into our state hoping to get safe marijuana now that it's legalized. Now, by the way, it was illegal for him to have it, but his friend purchased it legally and shared it with him. His product, you know, was a cookie with 6 servings of marijuana in it in one cookie, and not in any way broken up or any way to show him what a serving of marijuana was. So he ingested 65 milligrams of THC, and his blood level at death was over 7 nanograms of THC. Now, in my state, you're legal, presumed legal to drive up to 5 nanograms, but between 5 and 7, he became so acutely psychotic that he jumped to his death, actually. So those are products that's an edible product that was developed in the medical field. But the absorption rate for him was so slow that he kept eating it until he became acutely intoxicated. I mean, we've all read Marino Dowd's column, right? He died months before that she had that column written. Months before.
So, you know, again, the gap between 2000 and 2012, if this was perceived by Colorado voters as you describe it, as being such a, you know, problem to the state, it seems implausible that the state solution would be to expand the use of marijuana. What happened from your view? Because obviously there are others who would say voters didn't see it as a problem and they chose to expand this industry.
I would say that what they saw was so much hypocritical use in the medical industry or fraudulent use that their first decision was, let's make it available for everyone over 21, because that's essentially what we've already done 10 years ago.
Was there a campaign to roll it back? No.
There has not been a campaign to roll it back. There was a No on 64 campaign, but I'm happy to see I was part of this coalition here is very much more organized than the effort that was attempted in Colorado.
So the idea that you have, you know, in Colorado, patients were able to grow their own plants. We've got, in Florida, let's talk about Charlotte's Web and what that might mean for implementation of Amendment 2 if it passes. Again, the Department of Health will be responsible for regulating this. There's nothing in our amendment that says patients can be allowed to grow their own marijuana. There's nothing that says how close they have to live to a dispensary. So the department could, you know, I mean, you might be as well be blaming state of Colorado regulators for failing to impose enough regulations to guarantee the safety of people who live out there. Shouldn't, I mean, can't you make the argument, people who are supporting this, that if the state does this properly, you won't have this parade of horribles that you're talking about right now?
Again, it's the Amendment 2 modifies the Constitution. The rulemaking authority by DOH cannot make it more restrictive. The definition of a dispensary or a treatment center is well articulated within the amendment. I could speak to our enforcement efforts in Seminole County or Central Florida. 99% of the interdiction cases we make on marijuana are all from states that have either medical marijuana or recreational use. The high THC content is appealing to those who abuse the drug, and the price, the black market for that has dramatically increased in Colorado. Speaking to law enforcement there, it really is an issue. You could sell it for X amount of dollars an ounce, but on the high potency, black marketeers are offering much more per ounce, per pound to divert it. The gray market is another issue where patients actually are selling and distributing. In this amendment, as you know, that there's no definition of a caretaker. You could be a convicted felon. There's no relationship described between the patient. Department of Health estimates there will be 250,000 caregivers 450,000 qualifying patients, and 1,789 treatment centers in the state of Florida once fully implemented.
One more question. Can I answer also to her question a little bit? Everyone says my state's going to do a better job. There hasn't been a state out there that's legalized medical marijuana and didn't say they're going to do a better job. Your amendment gives your Department of Health 6 months to put regulations in place. Our amendment gave us 1 year. We still didn't do enough that we didn't have to go back to the legislature this year and put 2 Band-Aids in place, one of which had to do with the deaths from edibles. If you think that a 2-month legislative session coming up is going to be enough, or even the 6 months with the regulators going to be enough to get this right, I think you're being maybe too optimistic. This is a complicated, it's an onion, people. We are unwrapping it, and every layer brings something new, okay? And you won't even begin to anticipate what the issues are in the first 6 months.
Rachel, now that you have both medical marijuana and recreational marijuana, is Colorado a bad place to live?
Colorado is an incredibly beautiful state, and it's very difficult to raise a child there. One of the reasons I got involved in this 18 months ago is because I have a teenager, and I couldn't sit around and let the regulations be weak in the way that I thought they were with medical. And it is, let me just give you a little example, all right? Our amendment, especially the 64, said marijuana cannot be consumed openly and publicly. You have something similar in yours that says you cannot consume it in a public place. Well, how will public place be defined? Because my city council decided that on your front yard, 1 inch in from the sidewalk, that's private property. So that's not public consumption. So my son we live in an urban neighborhood. He passes people smoking marijuana on the street, okay? It is very difficult. They have put marijuana into products that makes it very easy to hide that you're consuming marijuana. The candy that gets sprayed, the vapor pens that are made to look like asthma inhalers, highlighters, bedazzled pens, dab necklaces, dab boxes that you can wear so you can keep your marijuana concentrate on your body. It is absolutely, the products out there are intended to encourage discreet use and to encourage young use. So I'm very concerned about where Colorado is going in terms of how do we get our children through school before they are enticed by this drug.